The context for this presentation is our involvement with the Responsive Evidence Synthesis Centre, funded to undertake reviews on topics prioritised by the National Institute for Health Research, the NIHR, Health and Social Care Delivery Research Programme. This particular piece of work was undertaken out of interest rather than being requested by the NIHR, so the following disclaimer applies even more strongly than usual. In October 2021, the Department for Health and Social Care and NHS England announced plans to establish 40 new community diagnostic centres, CDCs, across England. The centres would provide access to a full range of diagnostic tests and would accept referrals directly from GPs, minimising the need for hospital outpatient appointments. It was claimed that the new centres would improve access and convenience for patients. Centres of this type, also referred to as diagnostic hubs, have been operating for some time, but evidence of their effects on patient and health system outcomes is limited. Indeed, the report by Professor Sir Mike Richards that recommended the establishment of this new network of CDCs did not cite any research evidence at all. CDCs that are currently operating, like this one in Somerset, often involve delivery of NHS services by or in cooperation with the private health sector. This CDC appears to be purpose-built, but it has been suggested that services could be located in retail centres and high streets where people are used to going, and there are often empty shops or other buildings that could be refurbished and used as CDCs. In 2016, we published a report on diagnostic services in community settings that included a systematic review of community diagnostic ultrasound services. See the references at the end of this presentation. The review included 37 studies. Of these, just 3 were comparative studies of service models in high-income countries, or non-comparative UK studies. The 2016 review concluded that diagnostic ultrasound appears a promising technology for implementation in primary care or community settings, but the evidence base for patient outcomes, cost effectiveness and training requirements remains limited. Following the announcement of the 40 new CDCs, we used citation searching to rapidly update the review and assess the value of the original review and any new studies for informing the development of CDCs. We used free software called Publish or Perish to search Google Scholar in December 2021 for papers citing key studies from the 2016 review and/or the review report itself. We had already done an update search in 2019, and citations of studies identified in this search were also searched for in 2021. We recognise, of course, that a citation search is no substitute for a full update search, but our resources are constrained and we had to prioritise work that had been specifically commissioned by our funders. The 2019 review, update of the review, identified 3 new studies meeting the criteria mentioned above. Any design study from a UK setting or a comparative study from another high-income country. Studies reported that ultrasound scanning can reduce referrals from an urgent care centre and that focused cardiac ultrasound frequently altered diagnosis and/or management of patients in general practice. However, ultrasound-guided treatment in general practice did not improve recovery from shoulder pain in a randomised trial in the Netherlands, so overall mixed results on patient management from that small sample of studies. The 2021 update identified 9 new publications, all of which were about the use of ultrasound in general practice, including 2 systematic reviews. The number of citations per paper ranged from 1 to 74. The 2016 systematic review report received 15 citations, one of which was an empirical study that identified a need to improve referral for lumbar MRI scans within a community diagnostic setting. Again, see the references on the last slide. Other citing studies were commentary or opinion pieces or not relevant to the topic of CDCs. To conclude, there is an increasing volume of evidence supporting the use of ultrasound in general practice, but our latest update identified no new studies of its use in other community settings or comparisons between different service models. Recent research on CDCs in general also appears to be limited, although NHS organisations are developing practical guidance to help in setting them up. Methodologically, citation searches are quick and easy to perform, but are not an adequate substitute for an update of a systematic review. Assessment of specificity and sensitivity of the citation search would require a comparison with an updated database search, which would also allow comparison of the time and resources required. There is a need for research to support rapid and time-efficient updating of systematic reviews in fast-moving fields such as this that are relevant to policy. The other key implication is that there is an ongoing need for rigorous evidence synthesis alongside primary research, such as comparative evaluation of the costs and benefits of specific services in different settings to support the implementation of CDCs in the NHS in England. Thank you for your attention.